Looks like we can get started now, if that's okay with everyone. Good afternoon. Today's Housing and Services Resources webinar will focus on partnerships to expand accessible housing options with assistive technology. Next slide. My name is Rob Grindahl with the U.S. Department of Health and Human Services Administration for Community Living. I serve as the program manager at ACL for the 56 state and territory grantees funded under the 21st Century Assistive Technology Act. Next slide. Please note that this Zoom presentation is being recorded. For audio options, you can use your computer speakers or dial in with the phone number in your Zoom registration email. Participants are muted for the presentation. You are encouraged to actively use chat throughout the presentation, especially for your comments or to connect with other participants. Please use the Q&A, question and answer function to ask a presenter a question. You can also send your question or comment via email to hsrc@acl.hhs.gov. Next slide. The American Sign Language ASL interpreter will be pinned throughout the webinar. You can enlarge the view by pinning the ASL interpreters. To do so, click on the ASL interpreter video icon and select the pin icon. For screen reader users, you can reduce chatter or noise. Use insert spacebar S to request speech on demand. Next slide. Let's open it up for a brief moment. Today's poll asks, what is the primary sector for your work? You can see that the categories here are Medicaid, healthcare, non-Medicaid, housing, homeless, disability and or aging, human social services, not included in the above, community development, association, advocacy, philanthropic, education or research, consumer or other. Is this enough time to respond to the poll? Is now a good time to close the poll? For this HSRC slide, please know that the Housing and Services Resource Center is part of an interagency initiative to streamline and expand access to affordable and accessible housing, as well as the essential services that make community living and inclusion possible. Next slide. Next slide. This should be the results of the poll. Should we share the results for the poll or get back to those?
The results of the poll should be on your screen now. Looks like
Go ahead. Yeah.
It looks like our highest representation is from disability and or aging agencies.
Yeah,
So
that's
we've got some from housing and homeless and human social services as well.
yeah. Yeah, I saw that there was almost half or more for the top category. We can move on to the next slide. So for today's agenda, we are dedicating the bulk of the presentation to a partnership in the state of New York that expanded accessible housing options through the use of assistive technology devices and services, followed by questions and answers. Next slide. Just a word about accessibility solutions. Over 23 million households in the United States have accessibility needs to live safely in the community. Home repairs and home modifications, including the use of assistive technology, are critical tools for people to live independently and in the homes of their choice. Assistive technology solutions address all kinds of functional needs and enable adaptations to everyday challenges. Next, we will hear from the Accessible Housing and AT Partnership in New York.
Hi, good afternoon, or good afternoon wherever you are. My name is Melinda Dolezal. I am the director of the Technology-Related Assistance for Individuals with Disabilities program, also known as TRAID, which is part of the New York State Justice Center. So our assistive technology program, or our AT program, is housed within a state agency. But as Rob said, there are actually 56 AT programs within the country. I see some representatives in their participant list from, I believe, Florida, Montana, Vermont, and Nebraska, among others. So if after this presentation you're interested in going to learn more about your state AT program, there will be some information there. This particular project was done not just with TRAID, it was an amazing collaboration between the Council on Developmental Disabilities, the Alliance for Inclusion and Innovation, and some of the trade centers themselves. In New York, we have 12 trade centers that cover every single region, from the North Country down through Long Island out to the Buffalo region. And of all 12, there was 3 that participated in this, directly participated, as well as the Westchester Institute for Human Development, who helped to oversee this project. So without further ado, because this is a really done that took a lot of time and energy and had some amazing outcomes, I want to turn this over to Kristen Proud, who is the Executive Director of the New York State Council on Developmental Disabilities, or CDD.
Thanks, Melinda. Good afternoon, everyone. I want to thank each of you for taking the time out of your busy schedules to join our webinar today, and I hope you find it exciting to hear about this initiative and informative and also inspirational. I think we all know the really transformative role that technology can play in the lives of people with developmental and other disabilities. And so the New York Council on Developmental Disabilities was very excited to use some of our federal grant funding to engage with the Westchester Institute for Human Development on a 3-year initiative, which was done as a pilot project, as Melinda said, through partnership with the trade sites. In order to be able to assess individual needs, identify and then supply appropriate assistive technology, and then evaluate those individuals using that assistive technology who are living in non-certified settings. So today you're going to be hearing more detail from Azelle and others at the Westchester Institute about the grant work itself, and also, and most importantly, about the outcomes, which I think you'll find, really for some of the participants have been quite transformational. So with that, I will turn it over to our partner, Carol Napierski from the New York Alliance for Inclusion and Innovation.
Oh, thank you, Kristen. As Kristen had mentioned, my name is Carol Napierski, and I'm the Vice President of Program Development at New York Alliance for Inclusion and Innovation. New York Alliance, which is what we refer to ourselves as, is a statewide association representing about 130 organizations that provide supports and services to individuals with intellectual and developmental disabilities. Supports could include residential, employment, day program, just to name a few. So my work at New York Alliance includes the advancement of both assistive technology as a natural support and the education and development of resources associated with non-certified housing. New York Alliance has been razor focused on both the use of technology as a natural support and the advancement and the creation of non-certified housing options. Non-certified housing options are just homes in the community, from apartments, houses, ADUs, which are referred to as accessory dwelling units, and then the combination of the supports and services, which is certainly the technology component. So in 2019, New York Alliance was awarded a 5-year statewide and regional housing collaborative grant through the Developmental Disabilities Planning Council, now known as CDD. The focus of this grant was to create housing opportunities and support for individuals moving from a group home, to a non-certified, just a home in the community. So New York is quite large and quite diverse from both the housing inventory and the needs. From the rural areas where we may have housing options, but may not necessarily have a lot of public transportation, to larger cities like New York City, where we have the transportation, but we may not have the inventory of affordable housing. Knowing this, it was important for us when we launched the grant to create a housing expert in each of the 5 regions of the state. I'm going to back up just a little bit. New York Alliance also hosts what we call a robust housing navigation course, 36 hours, and it starts with certainly person-centered planning, goes through all the possible income and benefits a person may have, to housing types. So at this time in 2019, we had about 300 certified housing navigators. So we offer the opportunity for people to apply to become what we call a master housing navigator. We wanted, again, a subject matter expert, a master level housing navigator, to represent each of the 5 regions of New York State. So some of the roles of the master housing navigator included the creation of what we call a regional housing collaborative, where we gather all the housing stakeholders regionally to discuss housing needs and opportunities. And the stakeholders could include certainly individuals, family members, agency staff, developers, builders, state government, land banks, just to name a few. In addition to that role, the master housing navigators worked with at least 3 people in each of the years to assist them in creating a person-centered housing plan. The individual leaving a certified setting to a home of their own, starting out with the person-centeredness, looking at their income and benefits, and then helping them to find their home in the community. Over the time of the grant, the Master Housing Navigators assisted over 30 people to move into a home or a place of their own. What we found was a missing piece in the planning process was the opportunity to access technology as a natural support. In meeting with our funder, CDD, we spoke about the lack of access to these naturally occurring supports. CDD, knowing the of technology as a natural support, partnered with Westchester Institute for Human Development, which you'll hear in a few more minutes. So what's interesting for today's title of our time together, it's Partnerships to Expand Accessibility Housing Options with Assistive Technology. I want to speak briefly about the partnership, and I think we had mentioned kind of in our opening remarks. Certainly CDD was our funder, but beyond funding both the housing grant that I worked under and then also the assistive technology grant, they also connect us with resources in the community and other grantees. We have the Master Housing Navigator who collaborate worked with the individuals moving into their new homes or family members. And they also had the connection within the region, like the independent living centers, Westchester Institute, and certainly the TRAID Center, which is certainly regional and then it's also statewide. I'm very fortunate to be part of this grant, and I'm so looking forward that you're hearing the outcomes, how people use simple, naturally occurring type of technology to really help them within their new environment. So rather than going through some of the pieces of equipment, I think in our presentation shortly, you're going to hear about the types of technology that was introduced. So I'm going to pass along to Azelle Obermeyer from the Westchester Institute for Human Development to speak more about the journey, including the assessment and the equipment. Thank you for this opportunity.
Thanks, Carol. I appreciate it. Next slide, please. So this grant for us was quite a ways coming. We had a partnership with CDD for quite a while around assistive technology. And we were thrilled when this grant finally came about because we all knew that there were a lot of technology that was hard to get funding for that could make a huge difference in whether people could live as independently as possible, and not everybody had to live within congregate settings. We decided to partner with 3 TRAID sites in New York State, and we picked the TRAID sites based on their geographic location so that we had a good distribution across the state. So we had the Suffolk County, Long Island Independent Living Organization, also known as SILO. We had the Southern Adirondacks in the Capital Region, and then we had the University of Buffalo CAT, the Center for Assistive Technology, and we have some co-presenters today from the University of Buffalo Center for Assistive Technology. Next slide, please. So we really wanted to set out what exactly we wanted to accomplish in the 3 years. And as with most of these things, one can have really grandiose ideas, but I do think that we fulfilled quite a bit of this, and we made a huge difference in the lives of the individuals that participated with us. But we wanted to develop an evaluation toolkit. We really wanted to make sure that there was a sound process underneath what technology you choose. Now, we all know that it's the era of technology, and that people can see an ad on TV of something that looks weird and wonderful and could be the next best thing since cotton candy. But we wanted there to be a rigorous process with the involvement of a clinical expert to help make these determinations with the individuals in their housing situation, and to use good clinical judgment and to be able to justify why certain technologies would make a difference. And I'm hoping that by the end of today, you will have heard enough of the outcomes here to make your own determination on whether we succeeded on that one or not. Can you please give me the next slide? So we had a team of people that we worked with. I managed the program for WIHD in collaboration with my partner in crime, Dr. Trisha Patrick. Jeremy Lingo-Prost was our project manager. And then our expert consultant, Tony Gentry, was invaluable, and you were going to hear from him this afternoon too. And we have Erin Brunel from CAT-UB with us this afternoon. We also worked with April Duffy and Alberta Galdi from the 2 other sites. And I would like to also give a shout out to AAIDD, because we did use their SIS-A assessment as our foundation, that everybody who participated in the project went through this assessment, and it gave us a lot of valuable information to base the planning on, and also to evaluate again at the end. Next slide, please. So we had 13 participants who actively concluded the participation. We ended up having an additional 4 people who couldn't make it into the project because they couldn't get their housing organized. And that's one of the things we will be talking about. But the Long Island group had the highest number of participants. And I would like to definitely give a shout out to the housing navigator that we worked with in Long Island, Patricia Calandra is an unbelievable housing navigator, and it's definitely been because the biggest struggle we had with this project was to be able to have people participate who were in housing. And working with her was definitely a good solution for many of the individuals we had. They actually in Long Island currently have 6 additional people who came back and said, can we please do this some more because we're moving into housing soon. So they did a really great job of helping people get into housing. Next slide, please. On this slide, I'm just sharing some demographics. The average age of the participants were in their early 40s. We had more female participants than males by 9 to 4. 10 Caucasian, 3 African American, and we had most of our participants at least completed high school. 1 was still in high school and then also had some additional excuse me, education as well. And currently it's about half and half between employed and unemployed. Next slide, please. Next slide, please. We skipped over a slide, but I'm just going to go through barriers and solutions. Thank you. So the biggest barrier we found, as I mentioned earlier, was that it was really challenging for individuals with IDD to secure non-certified housing. And that the partnership with the housing navigators that we mentioned earlier was imperative for helping people do this. It is such a difficult process for individuals with disabilities, especially individuals with intellectual disabilities, to understand how to work the system, how to get to the housing, what supports are available in funding, and this service really makes a big difference in New York State for the people. So my kudos to the Alliance for creating this. Something else that we've had an issue with was that in places where people lived in apartments or in rented housing, sometimes we got an issue with the landlords who didn't want to give approval for some of the home modifications. Part of what we did for this was we created a letter agreement for the trade sites to use. It worked in some instances, but there were still instances where certain things the landlord were just not allowing for us to do. So, and then the other piece that we really wanted to talk about is to have access to clinical expert AT staff. And that's not the easiest thing to find. And finding someone who can give you that support and who knows about the technology and can really help determine what the best fit would be isn't the easiest thing to find. There are not a lot of experts in this area who work in the community. Next slide, please. Before we go to that, I think I'm going to, seeing as we're talking with individuals who participated, going to ask Erin and Michael to join us and to share a little bit of the experience with us. Thanks, Tony.
Hello. Hi. I'm Erin from the University of Buffalo Center for Assistive Technology. With me, I have another participant, Michael May. And I'll just take a few minutes to, well, not even a few minutes, just a moment to speak as well. But I know we'd all really love to hear Mike's perspectives, and I think he's ready to give them. So one comment about Maria as well, everyone's been amazing to work with. I think one really interesting thing that came out of her work was her apartment was not set up very well for her. So there was a lot of furniture that was not well placed, things that were really causing barriers that were needless in terms of how furniture was arranged. So it almost felt like we were doing some house makeovers at the same time, because we were moving cabinets and things like that around. She didn't have good access to her desk, and she is employed. So we actually got her a desk that she had access to, but her previous desk was this beautiful glass top, and she had pictures arranged underneath it of her loved ones and different events she'd gone to. we ended up finding a way to move that into her living room, and it became her craft desk. So that was some really interesting home adaptations that went on as well that I don't think were expected at the beginning of the project. So with me, I have Michael. Michael was our very first participant. He's been around now for a couple of years, and I'll hand it over to you if you want to talk about your experience.
Well, I found this experience very enlightening and useful. Like Tony said, even to be able to do the simple things when you're not able to do them before makes your life so much better. And I'm able to do everything on the computer because I can now talk to it, and I can do anything else and anyone else could do. And I also have Alexa, which gives me access to even music that I didn't have before. And I'm also able to turn off the lights and behind my thermostat, which I wasn't able to do.
And you've got your Roomba as well. Can you remind me of the name? Because I remember like
It's Alfred.
that's right. So it's Alfred, like Batman's butler, which I just loved. I felt like that needed a shout out. Alfred needed a shout out. And were there any specific questions that you felt like would be helpful for us to answer as well?
Ellen, I think just getting the feedback of the impact is what we'd like to share here. So thank you very much. And Michael, thank you very much for joining us today as well.
Thank you.
Thank you.
Is there anything else you would like to share with us, or?
I think so. You had mentioned as well after the project was closed, there was a couple people had reached out about still needing the services. And I would just echo that we've had the same kind of calls where it's, you know, the need is very much there, and it was great to be able to do this for 3 years. But I'm glad to see this whole conversation going on, just in terms of potentially being able to pursue these types of grants in the future as well. I think that there's a dire need for them. It was great to see the impact we made, but I'd love to see it continue to grow as well.
Thank you, Erin, and thank you, Michael. Yes, that thank you to CDD for giving us the opportunity to have this grant has been such an eye-opener for all of us on the difference that the technology can make, and how empowering that can be. If I can go back to the video that you couldn't hear of, excuse me, of Brianna's aunt. One of the things at the end she says is this has allowed Brianna to actually be able to share so much more of what she wants and what she needs than she ever was able to. So the empowerment is definitely a common theme that we saw during the 3 years of this grant. And I have to share with you guys that this grant came about and it recruit participants who had the housing already so that we can get going. But once we got going, the technology just kept on making a difference. So thank you very much for that.
And I did see a note that some of what Mike said did not pick up on the caption.
Yeah.
So I'll reflect that in the chat. Just give me a few moments, Mike, and I will type it out too.
Okay. Thanks, Erin.
Thank you.
Can I just ask the person who's organizing the slides, is this housingtech.wid.org link active in the slide deck? Can you click on it for me?
So yes, it is active in the link, but if I click on it, it will direct us out of the PowerPoint.
Okay, so I'm going to then go and talk to you about, I did put some screenshots into the slide, so let's just work off of those. Go ahead. Next slide, please. So the next thing I'd like to talk about, and Tony, I'm going to ask you to jump in here as you see fit, because a lot of this work is work that you did. Tony and I worked together in the beginning when I first asked him if he would work with me on this project, because I consider Tony definitely the king of cognitively accessible technology. Tony is an occupational therapist by training. And we went through what it was, how we would like this to be. And there's a lot of information out there if you do a Google search on technology for housing. And how do you decide what if this is a good fit or not? So Tony really worked with me on developing some specific tools, checklists, a document that guide the process of how you look for the equipment that you're looking for. How do we determine if someone, when we gave them some smart home tools, what the satisfaction with that was? And we created a housing tech evaluation toolkit on our website, housingtech.wid.org. And we put that toolkit out in the public domain, so you should be able to see it. But if you go to the next slide for me, please. Between Tony and Jeremy, our project manager, they created this roadmap as part of the evaluation toolkit. And I thought the visual really works well in helping people navigate how we go about it. And for each of these, if you click on each of these boxes on your screen with an image, a PDF document opens up that you can download that you can use. For example, we have a demographics intake form, but the one I really would like to highlight here is in the next slide. There's a how to use the roadmap. And this how to, that Tony works in cognitively accessible technology, because the how-to is very good for helping someone work through the process. So can you go to the next slide for me? There you see. So here is each section in that roadmap. There's an explanation in this how-to guide. Tony, do you want to give a quick, brief introduction just to that?
Yeah, it might help if we go back to the previous slide.
We like that graphic. Please go back to it. There you go.
Just briefly, if you look at the different circles, I'm going to walk from left to right through the circles really quickly. The demographic intake form, I think, explains itself. The second piece, the smart home interview, New York, I call it the shiny, is a guided interview that would be done by the assistive technology professional and the person that they're working with to discuss needs in the home. The second piece, which is called the home assessment, review, and demonstration, is an interview sheet that allows you to also walk through the home or roll through the home with the person that you're working with so that they can demonstrate for you what they can and cannot do in their home at this time. Combined with the shiny, you're going to end up with a pretty good comprehensive sense of what the needs are around assistive technology. The ATHA card, which is the fourth one, is a tool that compares what you've learned from the interview and from the walkthrough, and provides suggestions for assistive technologies that you may or may not have thought of to address those problems. The last two tools are, the fifth tool is a form that allows you to list and keep track of the technologies that you're providing and provide notes for yourself around how they're working and what you might need to use to adapt them. And the final piece is an interview that is done with the client at the end of the intervention, where they tell you how satisfied they are with the tools that you provided and give feedback around things that they might prefer otherwise. So to my mind, this is a fairly comprehensive soup to nuts, beginning to end set of tools that can help you provide the interventions that you would need for someone with a developmental disability in the community.
Thank you, Tony. And thank you so much for all the hard work you put into this as well.
Thank you.
Can we go to the next slide, please? And the next slide. So this is just another screenshot of one of the forms that Tony talked about that is on that website. Next slide, please. So when we talk about assistive technology and how we use this for individuals with disabilities, there's just a lot. And I saw that you guys had a bunch of questions around the list of technology that we used. And Jeremy and I can work because each one of the participants have a list of the technology that we recommended for them. So we can put that together, and I'd be happy to share that. I would like to just caution against just looking at the technology. So when we work with individuals with disabilities and technology, using any one of these approaches, like the SET approach, which is the student, the environment, and the tools, how do we do and fit this all together? Making sure that we put the clinical reasoning behind this, so that the technology we provide will meet the needs of the things that an individual is struggling with to help them become more independent, but also to really tap into the things that a person has as strengths in their lives. And then the person-centered approach cannot be stressed enough. Now, when you spoke to Erin and Michael, I think that's something that came across so well for me is you have to work with the individual and believe that they can tell you best what the things are that they're struggling with and what the things are they would like to do. And then it's up to the technology expert to say, okay, there are 2 or 3 things we can consider here. Let's try and figure out how we can make it work. An example I can share with you is I worked with a young lady who needed to get computer access. She was paralyzed from her neck down. And she absolutely 100% refused to use a head mouse because she didn't like the idea of having the dot on her forehead that the camera can communicate with. She was willing to work with voice recognition software to do commands of her mouse on her screen. And she became 100% independent in her computer access because she chose which method works the best for her. And this is what I saw in this 3-year grant we had, is the TRAID site staff worked so closely with the people who participated in the project to really get a sense of what their needs are, not what I as the professional think your needs might be, what you as the person in the housing situation identifies as the things you want to do the best. And then we help create the solutions. When Tony spoke to us about Michael and the fact that his parents were terrified of him living alone, that's a very real problem to have. And working with him within that team of his support was as important as to hear from the individual themselves. So coming back to how we approach this, we identified people who were important in the lives of the participants in the project, and we identified the expert staff, and we brought it all together so that for each one of these, in my opinion, of the 13 participants is a unique case example of person-centered practice on steroids, in my opinion. We really made an effort to make that the foundation for this project. And I think the outcomes speak for themselves when we look at that. On that high note, I'm going to ask if we could look at the questions and see if we can answer those for you guys. I'm going to open the Q&A. So we would be happy to share the letter of agreement for the home mods. I'm assuming you are talking about the one for a landlord. So we'd be happy to share that. I think the best way to do this is we'll share with Esther, right? Esther, am I getting the logistics of where we send it for distribution?
That is fine, yes.
Okay, thank you. And as I said, I saw that there are many people asked for the list of the technology. We'd be happy to put that together, with the caveat that we'll look at that and see what fits best, right? And then someone asked, there's being so many wait lists for housing in many states. How were you able to overcome that barrier? I'm not sure we overcame that barrier, to be very frank. I think we tried to work within the system as best we can. I think part of the difficulty we had with this grant was the fact that it was difficult for individuals with disabilities to acquire the housing. And I saw Carol on screen just briefly. So Carol, do you want to jump in here as well?
Yeah, I'd love to. Azelle, thank you so much. So as this whole topic is partnerships and collaboration. So the grant that we had, the housing grant, we, as I had mentioned in my opening remarks, created regional housing collaboratives, bringing people together to make housing happen. It moves the needle ever so much, or it moves the needle ever so slightly, but it moves the needle. So Long Island, when we brought together for the regional housing collaboratives, the developer and the provider kind of all got together and started talking about how to build in a particular area affordable housing. Housing happened. It's an apartment complex. It's in a beautiful location. But if you weren't part of that whole discussion or part of that regional housing collaboratives, it wouldn't have happened. Much like this partnership and this collaboration with CDD, Westchester Institute, the TRAID centers. There's a value of all coming together. It moves the needle ever so slightly, but it certainly moves the needle. Thank you, Azelle.
You're welcome, Carol. I think something that we also found is in New York State, there's an office for people with developmental disabilities, OPWDD. And about 2/3 through the grant, there were some questions from people who work at OPWDD about the outcomes of the grant. And we've already seen that some things are being reconsidered for funding based on the fact that we could show the difference that it makes in the lives of individuals with disabilities. So I feel as we can try this, each one of us, when we do this, we really need to all work together to get the word out. And when I first met Rob Grunendahl, I wasn't 100% sure how it all fitted together, but I truly cannot thank him enough for opening up this agenda to this big of an audience for us, because each one of us can now start spreading the word more. And I think that helps a lot. And I saw in the chat that many people who work in the realm of assistive technology also signed in. So I would love for all of us, when we work with clients, when we work with participants, when we work with individuals who struggle to live independently, when we do something and it works well, we share that with whomever we can in our state. That'll help move that advocacy agenda forward. And then the flip side of that coin, the struggles you identify, the challenges you identify is almost more important than the successes you get. Because those barriers that are put in the way of individuals with disabilities and having access to independent housing is something we really all need to work together to break down. The funding source, the question from Emily about the funding source for this, as we said, it is this was a grant through the Council on Developmental Disabilities that we are eternally grateful for. Doing the advocacy, as I said, we've been working with CDD for years around assistive technology, and they were the ones that saw that this is an important agenda and went after funding to help us make this grant a reality and make a difference so that we can showcase. And what I really appreciated about this is when we first met with Jackie and her team, she said to me, we really want to focus on quality here. No, we don't want to do 300 people and we don't do a good enough job of each one of those. We want to show case studies of what can work for individuals with disabilities. And we appreciated that mandate immensely, because it really gave us the opportunity to have someone like Tony not only be available as a resource for the trade site staff in his expertise, but also be able to go around and meet with the individuals and really get a sense of how did this work, how did it not work, what were the issues, and how can we make it better. And those lessons were invaluable. there is the list for devices and tool names again. I'm just scrolling through the list, I'm sorry. List of devices. So there were the two individuals in wheelchairs were two of the ones you've seen. We've had more people in wheelchairs as well. And there were, Erin, maybe I can tap you here. Were there any particular issues addressed? Because it may be nice for you to share a little about the sensors that you guys were working with.
Sorry, Isabel, could you just repeat that? We had a little technical difficulty on our end.
Okay, so the question says two of the individuals used wheelchairs. Were there any particular issues addressed by? And I thought you may just share a little bit about the sensors and the because I thought that was so cool.
Certainly. So actually, I believe all of our participants were in power chairs. So Mike is a power chair user, and one of the needs that I'll be honest is still kind of in the works. There were some hiccups with it, which I'll talk about too, but there's actually something called the Braze mobility sensors, and they're a toolkit of sensors that can be installed around a power chair so that, for instance, if Mike was to back up and his really cute cat was like behind him and, you know, was trying to get into trouble, Mike would get a beep indicating that there's an obstacle directly behind him. The barriers we came into with it were right after they were installed. I think you had a joystick that broke on your chair. So your chair was sent in for repair and so the sensors were not taken off. So there's sensors missing, and they are now funded to be replaced as well. So that's something we're getting resolved, but it was a really interesting toolkit of sensors.
Thank you for all of you.
So we're working on some of the mounting stuff with the wheelchair vendor as well. It's one of those pieces of technology that's also very new. So we're kind of discovering the hiccups live, which tends to happen, but we're able to connect with the company and the wheelchair vendor to hopefully get that resolved.
Thanks, Erin.
No question.
So I'm going to end here to just give a one last. But on the last, we talked about security and privacy of the devices. These were handled individually, you know, depending on the technology we implemented for the participants. But I would like to say that, you know, we were fortunate that this was grant funded, so we didn't have to find justification for the funding. You know, we worked through the evaluation process, and based off of the thorough evaluation, we made the recommendations for the technology, purchased it and implemented. I would like to wrap this up by saying we didn't share with you guys what a definition of assistive tech is, but most of you are aware that assistive technology has two parts to it. It's the technology devices and it's the services. And I cannot stress more how important the services are if you give people assistive technology. You can't just give people a bunch of boxes with equipment that rocks up on their front door and all of a sudden think they're going to be independent. That's not how assistive technology works. If you want someone to use technology effectively, you have to help them set it up and you have to do training on how to utilize it and make sure that the person reaches a certain level of comfort with using their technology. There is no way that we can do any of this if we don't plan into it the services and the training that is needed to help an individual with a disability and their circle of support be comfortable with the technology. Something else we spoke about, and that's one of the major reasons why we decided to partner with the TRAID sites, is so that for the sustainability of the individuals we worked through these 3 years with, they have TRAID sites in their area that they can go back to where there are technology support available. We don't want to give people the technology and then just leave them. If they have an issue, they need to have resources that they can go back to. So in some of the questions, I do not have the answers of how we really are going to fund this. We have talked in New York State about self-direction money and how we would do this. The comment about using a life plan as justification is something we could definitely consider to see. But our focus here was to to showcase that it makes an immense difference in the lives of individuals with disabilities if we can provide the right tools for them to be as independent as they can, and to live in the housing situation they choose. If they do not want to live in a congregate setting, there are opportunities that we have showcased here that will help them be able to be as independent as they can. I would just like to ask, is there anyone from my team who would like to share a last thought?
So while you guys are thinking about the last thoughts here, and if you do, please chime in. This is Rob Grindal with ACL. Hopefully folks can hear me. We are at the hour. And so what we'd like to do is actually potentially move over to a survey slide for folks if they could respond to that. I do want to note while folks are responding to this survey slide that today's slides, recording, and transcript will be posted on the HSRC website. The information, additional resources, please visit the site that we provided, acl.gov/housing and services. The Housing and Services Partnership Accelerator currently has 8 participating states plus Washington, D.C. The accelerator supports states and communities to accelerate the development of innovative state strategies to provide housing activities for people with disabilities and older adults at risk or experiencing homelessness. For the Housing and Services Accelerator Grant Competition, applications are due to the Administration for Community Living by 10 a.m. Eastern Time on December 20th, 2024. The full application can be found online on the HSPA web page at https://acl.gov/housing and services/accelerator. Please also direct any questions to hsrc@acl.hhs.gov. I believe we're about 2 minutes over for this presentation. I know there's some additional slides that we have, but I think that we have the crux of the presentation. I just want to note that please don't hesitate to email us at that address that I just provided. We are interested to learn about your partnerships and innovations, and we welcome subscribers to the HSRC listserv. It's over 20,000 and growing. And go to that hub that was mentioned, acl.gov/housing and services website. So with that, I can't thank the New York team, Isel in particular, as well as your all-stars on this project. This is just a fantastic presentation. And for the other presenters, on this, just what a way to spend an afternoon to learn about this project. So I'll hand it back over to the facilitator if there are any other closing remarks.
Thank you very much.